Dear colleagues, good morning from all of us here at EU OSHA in Bilbao. And a big thank you to the organisers of today's event, the University of Urbino and Fondazione Triva for this invitation. We're very happy to have Fondazione Triva as our campaign partner, and of course also thanks to Inail as sponsors of this International OSH Festival. Inail, of course, who we've worked so closely with over many years as our national focal point. EU OSHA is really delighted to support this initiative, and already this year our research manager Maurizio Curtarelli made a presentation on emerging occupational safety and health risks. For next year, we find this topic that's been chosen, promoting a culture of occupational safety and health and the importance of organisation in worker well-being, very, very relevant. Occupational prevention culture has been a long-standing priority for us here at EU OSHA. I can mention our Healthy Workplaces campaign, for example, the campaign that was just ended last week on musculoskeletal disorders. I hope some of you were able to participate in that event. More generally, our awareness-raising actions, for example, the cartoon character Napo, which we collaborate with Inail on, the network of occupational safety and health vocational education providers, OSHVET, but also the tools that EU OSHA produces for the workplace, like OIRA, and the research that we carry out to identify the most important issues in OSH. So it's a great choice to focus on digitalization, psychosocial risks, and the fragmentation of the production cycle. Here at the agency, we're working on these topics as well, and therefore we can look forward to very positive collaboration. If we look at digitalization, this is the last year of our 4-year research program on the topic, and we're starting next year a Healthy Workplace campaign that will run until 2025. We're looking in that work at several different topics, advanced robotics, artificial intelligence in the management of workers, at digital platforms, and at the use of smart monitoring systems. In all of this work, we're identifying the upcoming challenges and the OSH risks, but also the opportunities that these technologies will offer. In the area of psychosocial risks and mental health, this is the first year of our 4-year research program on the topic, and we're proposing to our management board that we start a campaign in 2026 on mental health and psychosocial risks, and that would focus particularly on overlooked sectors and occupations. In relation to fragmented production cycles, I can mention our work on supporting compliance. This research looks at the factors external to an enterprise that impact on how it manages health and safety. We look on the one hand at elements that are related to state influence. So, for example, the Occupational Safety and Health Inspection Service. And on the other hand, we look at the market influence. And in there, we're looking at the supply chain effects, in particular in construction and agriculture. So I think very relevant for this initiative as well. And I can also mention that we have research starting next year focused on the health and social care sectors, which again, I can see in the program for Urbino will be an opportunity to share knowledge. Coming back for a second to psychosocial risks, I'd like to share with you some of the figures, some of the data that we have relating to this issue. The most recent surveys show that stress, depression, or anxiety are the most common type of work-related health problems. And 45% of workers report risk factors for their mental well-being at work. From the workplace perspective, our own survey, Essener, finds that dealing with difficult patients, customers, and pupils affects 60% of enterprises, and excessive time pressure is reported in 45%. So we can see that this is a real priority topic. More generally, we can see an increase in workplace stressors, for example, low level of control and rewards at work. And this is something that the research is showing is particularly affecting people in lower skilled occupations. So people working, for example, in construction, agriculture, cleaning. And that's why we've focused on this in our campaign proposal. More recently, of course, COVID-19 pandemic has exacerbated this situation. The need to have physical distancing, experiencing economic challenges, fear of infection or fear of infecting loved ones, and other factors related to the pandemic led to an increase in anxiety and depression after the outbreak. This year at EU OSHA, we ran a workers survey, which we've called the OSH Pulse, and that's given us some new insights. And we're able to compare those results across countries. Some of the questions we asked related to psychosocial risks include whether there's a reluctance to be able to talk openly about mental health issues in the workplace, and whether this is a barrier to addressing psychosocial risks. And we found that in this question in Italy, workers were more likely, significantly more likely to identify a difficulty in raising these issues. They also, I have to say, in Italy were more likely than the European average to say that disclosing a mental health condition would impact negatively on one's career. But on the other hand, a majority also said that the COVID-19 pandemic has made it easier to talk about stress and mental health in the workplace. So maybe we're on a good path. I would also say that for Italy, that survey identified that there's a comparatively low level of mental health initiatives. So, for example, consultation of workers on mental health issues, or providing information or training or counseling and psychological support. So clearly, I think this initiative is very relevant and should be most welcome. You can explore the issues around management of psychosocial risks, especially in small enterprises, in a research project that we carried out and published a report this year that's based on the results of our Essener survey, this survey that asks in workplaces about management day to day of health and safety. And this study highlighted the importance of having a clear framework on the management of psychosocial risks, the importance of being able to provide enterprises with clear guidance and support, but also the need for orchestrating. And in that sense, the research has meant coordinating the work of all those different organizations that an enterprise comes into contact with. So, for example, the Labour Inspectorate, the provider of occupational safety and health prevention services, the social partners, but maybe also banks and insurers. So I recommend that report for you. So finally, just to say again, congratulations on this initiative. At EU OSHA, we're delighted to be collaborating with you. We're delighted that we were able to facilitate your collaboration with the Basque Prevention Service, Osalan, and also with the local Deusto University here in Bilbao. So I wish you best wishes for the rest of this event and look forward to seeing you in Urbino. Thank you.